Hello everyone and welcome back to my video series on cognitive behavioral therapy. Today we'll be going over the structure of a CBT section. So typically each CBT session typically lasts 45 to 60 minutes and follows a structured of a 5-phase format. So there's check-in and a mood update. The therapist and client will review current mood, stress levels, or symptoms. Client may discuss any challenges or successes since the last session. There should be some review of previous session and homework. Homework assignments are central to CBT. The therapist will review any completed exercises and discusses any insight and identify any barriers. If homework was not completed, the therapist may explore obstacles and problem solves with the client. Next, we have setting the agenda. The therapist and client collaboratively decide what the session should have prioritized. The agenda ensures that the session stays focused and goal or directed. Skill building and cognitive behavioral techniques are the next step. The therapist shall introduce new techniques such as cognitive restructuring, exposure therapy, or behavior activation. Clients practice these techniques during the sessions. Next, we have assigning homework and the session wrap-up. Homework is assigned to reinforce learning and encourage real-world application. The session ends with a summary and feedback, allowing the client to reflect on what they've learned. Next, we'll take a little dive in as the role of the therapist and the client in CBT. So the CBT therapist plays an active, structured, and collaborative role in treatment. The primary responsibilities include guiding the session structure, which ensures that the session remains focused, goal-driven, and productive. The next role is to teach cognitive and behavioral skills, providing clients with evidence-based techniques to change unhelpful thinking and behaviors. They should also encourage self-exploration and insight, helping clients identify patterns in their thoughts, emotions, and behaviors. Challenging cognitive distortions is also a role of a therapist, using techniques such as Socratic questioning to help clients recognize and reframe irrational beliefs. A big role of the therapist is assigning and reviewing homework, ensuring the skills are practiced between sessions, as most of the work for CBT happens in between sessions. And the next big role is to provide a supporting and validated environment. As always, you should always create a safe space for change while maintaining a directive approach, especially during CBT. Because unlike in psychodynamic therapy, where the therapist takes a more interpretive role, CBT therapists actively collaborate with clients to develop solutions. And as CBT is a collaborative therapy, this is where a client plays an active role in their treatment. Clients are expected to engage in self-reflection. They should be identifying and analyzing thoughts, emotions, and behaviors. They should participate in cognitive restructuring. They should challenge and modify their irrational beliefs and practice behavioral interventions, implementing techniques like behavioral activation, exposure, or relaxation exercises. They should also actively engage in completing homework assignments, applying skills outside of therapy sessions. They should also communicate openly, providing honest feedback on therapy progress or any challenges that they may come across. A CBT is most effective when clients actively participate rather than passively receiving insight from the therapist. The goal is to empower clients with skills they can use independently. Homework, as I said, is a crucial part of CBT because lesson change happens between the sessions, not just in therapy. Homework assignments can help clients reinforce the skills they learned in therapy. By practicing techniques like thought records, behavior experiments, and exposure exercises. They can apply strategies in real-life situations by generalizing learned skills beyond the therapy room. They can build self-efficiency and independence by homework by encouraging clients to become their own therapists over time. And it's a way to measure progress. Homework allows clients and therapists both to track improvements and identify any barriers or challenges that may have came across. Some examples of CBT homework assignments could include thought records. So this could be just writing down automatic thoughts and challenging them. Behavior experiments, testing negative beliefs in real-life situations. Exposure hierarchies, so gradually facing favored situations, or even just self-monitoring logs, tracking moods, behaviors, or any triggers. Clients who consistently complete homework tend to see faster and more significant results and their symptoms. Some common challenges in a CBT session could include, even as it's structured, it could include how clients may struggle with homework. So you can identify barriers, modify assignments, and reinforce the importance of practice. There may be some resistance to cognitive restructuring. So some solutions could be use gentle sporadic questioning rather than direct confrontation. There may be an emotional avoidance, so a solution could be gradually introducing exposure techniques to help clients confront difficult emotions. There may also be difficulty setting sessions agenda, so you should encourage clients to prioritize key concerns and use a flexible approach, because by recognizing these challenges and implementing strategies to address them, therapists can keep sessions productive and impactful. The structured nature of CBT enhances efficiency, goal achievement, and long-term success. A well-structured CBT session ensures that therapy remains focused and effective, clients develop and practice actionable skills, progress is measurable over time, and clients feel engaged, empowered, and accountable. Big goals in CBT is the SMART goals, having those attainable, measurable goals. And by maintaining a clear session format, therapists and clients work together to create meaningful and lasting change. Next, so as we learned today, CBT sessions are structured and include skill building and homework. And homework is a very, very critical part of the CBT work. So next we'll discuss the evidence supporting CBT's effectiveness in the next video. Thank you.